COVID. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the Government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
A very warm good morning, and thank you so much for joining us this beautiful morning of Friday, the 20th day of August 2021. It is Health Friday as usual, and I have an expert himself bringing us informative sessions on health and health practices and lifestyles. And today we are demystifying one of the chronic ailments, diabetes mellitus. And I would like to introduce my guest before we proceed. Dr. Lango,
yes.
It's good to see you.
Good to see you too.
Please tell our viewer who you are and what you do.
All right. My name is Dr. Lango Bernard. I work in Mata Hospital, Accident and Emergency Unit. So basically that's what I do. I see regular patients and emergency patients in Mata Hospital.
Thank you so much, and welcome once again.
Thank you, Elizabeth.
And my name is Sasha Elizabeth. This is Health Friday. Welcome, and let's talk health. Okay, now Dr. Lango, to start off, we've heard of diabetes and diabetes mellitus, and then there are other diabetes insipidus. Could you please help us understand what is diabetes and diabetes mellitus?
Thank you once again, viewers. Now, we want to discuss today mainly diabetes mellitus, but to give you a heads up is that we have what you define as diabetes is basically abnormal rise in blood glucose levels. Okay. The main type of diabetes that we are having too much these days is called diabetes mellitus. Okay, diabetes mellitus, and particularly type 2 diabetes mellitus. Now, diabetes mellitus type 2 is the array of abnormal rise in blood glucose levels because of some processes going on in the body. Number one is that we are having resistance to insulin that we normally secrete from our pancreas. Okay, so when our cells are not responding to insulin, and yet we know insulin is the one we use to take up the glucose from our blood, so that the blood glucose can remain normal. Then number two, we are also having, sometimes we have very little secretion of this insulin from our pancreas because the sugar, the high blood sugar, also disorganizes the pancreas and makes it unable to produce what? To produce this insulin, which is very important in regulating the glucose. Okay. Then we're also having abnormal production of glucose itself from the liver. The liver also breaks down glucose and releases too much into circulation. Okay. So these are a combination of things which make our blood glucose go high in type 2 diabetes mellitus.
Okay. All right. Now, remember, you can engage with us and be part of this conversation through your comments and feedback on our social media platforms, on Facebook, Capuchin Television Network, on Twitter, Capuchin TV Kenya, and YouTube. And you can also send an SMS or call our lines that the numbers scrolling on your television. So we continue. Please share with us what obesity is and how does it predispose us to diabetes?
All right. So now we should know that diabetes type 2 diabetes mellitus is we don't know really exactly the direct causative agent, okay? But we know there are so many risk factors for getting type 2 diabetes mellitus, okay? The most important risk factor I want to discuss also today is what? Is obesity. Obesity is, we define obesity as abnormal BMI, okay? BMI is called body mass index. Now, in simple terms, is that is being overweight, I mean gaining too much weight, okay? If you're gaining too much weight, normally you gain too much weight because you accumulated too much fats in your body. Now, if you come to the hospital, we are going to measure your weight, and then we also take your height. Ideally, somebody who is taller is supposed to have a higher weight, right? If you're shorter, we also expect you to have a lower weight. So when we compare, we calculate this in the hospital, okay? We put your weight, okay, then divide by your height, which is in meters, and we square it. We square the height, so the product is called BMI. If your BMI is less than 18.5, we say you're underweight, okay? Ideally, you're supposed to gain more weight, right? Okay. Now, if your BMI is between 18.5 up to 24.9, that one we call it normal weight, okay? Then if your BMI starts from 25 up to 29.9, we say you're overweight. Then now, when your BMI reaches 30, okay, from 30 now it can go to any figure. We say you're obese. That's what we define as obesity. So obesity is defined as a BMI of 30 and above. And this obesity, again, is the severity of this obesity. Some people have mild obesity, grade 1. Grade 2 is when grade 1 is when your BMI is between 30 to 34.9. Grade 2 is when your BMI between 35 to 39.9. Then from BMI of 40, we say extreme obesity. You see this?
Okay, so now what is the recommended body mass index for a healthy person?
Yes, so as we defined with the BMI, we say the recommended body mass index is between 18.5 up to 24.9, okay? So this range we consider as normal. Take into considerations where you come from, your family, where people are overweight, things like that. Races are different, okay? That's why it's a range. It's a very large range to cater for all these all these categories of people. Then also besides the BMI as a major risk factor for getting diabetes, we also have what they call waist, the size of your waist, okay? The size of your waist also influences whether you're going to be at risk of getting diabetes or not. The size of your waist, we basically use it becomes more important in people who are not obese, okay? People who say they have a normal BMI, but their waist size is so much. So it becomes a major risk factor in this category of people.
All right, now what is the link? How does obesity really increase our risks of contracting diabetes?
Exactly. Now, the studies, we have done so many studies around the world, okay, and they've closely linked being obese with the risk of getting diabetes, okay. The more you're obese, the more you are likely going to get diabetes. That one is known because of too many studies which has already been done. And we also know that when you go into details, when somebody is obese, he has accumulated too much fats in the body. These fats in the body, they interfere with normal cellular response towards insulin. If my cell normally it allows insulin to come and step on it, and then it opens up the pathway to take up the glucose from your blood. In this case, people who are fat, their cells even if the insulin goes and attaches on them, they don't respond to insulin. So what happens? Progressively, you keep accumulating more and more glucose in your blood as you eat food every day, okay? So your blood glucose starts to rise up. That's one of the ways that we have realized that the obesity increases your risk of getting what? Getting diabetes, okay?
Thank you, Dr. Lango. Now, what is the prevalence rate of diabetes mellitus in Nairobi, and what are the contributing factors to that?
Oh, yes. Now, starting from around the world, currently there's a rising prevalence of of diabetes all over the world, but more importantly in developing nations. Okay, Kenya is one of them. Okay, actually, if you look at Africa as a whole, Africa is basically developing a developing continent. And looking at Kenya is a developing nation. People are getting more and more wealthy. So when people are getting more and more wealthy, the lifestyle tends to change. We tend to change from our routine going to the garden, digging to plant your crops, then you harvest your crops, then you eat food. To going these days now, most people are going to sit in the office. Like us, we're sitting, you're doing your work, right? You're no longer going to the garden. This work is not exercise. the exercising when you're talking is not enough exercise. We don't call it exercise, okay, to fight diabetes. Now, when your work is you're sitting in the office and you're not exercising, breaking down the glucose that you're always taking in the food, then you become more and more overweight. And then you reach this extent of getting obesity. And so this is one of the major reasons why we're having increasing number of cases of diabetes. However, we know in the hospital setting, we have only local data in the hospitals. Each and every day we're having increasing percentage of people who are coming to the hospital because of diabetes, or we're discovering more and more people when we do the routine blood checks, okay, that they're actually having diabetes, and yet they're not aware. Because over 50% of people who have diabetes currently, they're not aware that they have diabetes because they have not even checked their sugar. They only come to hospital when they start having symptoms, and by that time, it has taken so many months or years, okay, before they realize that they have diabetes mellitus type 2, okay, because it comes very slowly without giving you any symptoms. We only discover you in the hospital. So there's rising prevalence of diabetes, particularly in Nairobi where we're practicing. In local data as Nairobi itself, we don't have right now, but we know from the hospital setting, we have very high percentage of people who are coming who we are discovering to have diabetes.
Okay, you've mentioned the symptoms and signs. Like, we understand most health conditions exhibit some unique or rather some symptoms that even similar to other ailments.
Exactly.
So what are the complications, maybe before we get to the normal signs and symptoms of diabetes, what are the complications of diabetes mellitus in our bodies?
Oh yes. It's very important you ask that question. Now, diabetes mellitus, particularly type 2, that we know is the most common type of diabetes we're having right now. It comes with so many complications, which at the end of the day lowers our lifespan, okay? And it becomes a very serious health burden to the nation, to the family itself, and also to the hospitals. Now, diabetes causes, when you have diabetes, your blood glucose is high. When your blood glucose is high blood glucose is toxic to what? To the cells, especially because it's blood glucose. So we're looking at the cells which are lining up the blood vessels, where this blood is flowing. So when it's toxic to these cells, it damages these cells, and then these cells start exhibiting abnormal responses. Now, these abnormal responses of these cells which are lining up the blood vessels now leads to these complications what we're looking at shortly. Now, number one, When you're looking at the small blood vessels in the body, very tiny blood vessels in the body, the blood vessels that are going to your eyes, they get damaged. Now, when they get damaged, you're going to get what we call diabetes retinopathy, right? Sooner or later, you're not going to be able to see. You look at the small blood vessels which are going to your nerves, they're supplying your nerves in the body. These people are going to start going to the hospital because they're having abnormal sensation in their body. The patient comes, they keep telling us, I have this numbness. Okay, numbness in Kiswahili, they say naganda, right?
Ganzi, yeah.
So they keep coming with these complaints that abnormal sensation in the body, because now your nerves are getting the damage, because the blood vessel which are otherwise supposed to nourish them, they've been damaged. Then you have the small blood vessels. I mean, these small blood vessels are also going to your kidney. Okay, they're actually in your kidney. Now, when you start having these small blood vessels damage in the kidney, then you're going to start having a kidney injury, right? And it's always chronic and progressive. So you start having silent damage to your kidney. You're not aware. Okay. Then the large blood vessels in the body, when they're damaged, okay, they're going to your brain, of course, supplying your brain. These people start coming getting strokes, okay. People start coming because of heart attacks, okay, because of these large blood vessels have been damaged. The blood vessels supplying your legs. People start coming with wounds which are not healing in their legs, because these blood vessels have been damaged by what? By the toxic high blood sugars, okay? All over the body. So diabetes basically eats up all your body. So all parts of the body are going to get some particular damage. Okay, so we have a line of complications from diabetes.
Oh, thank you so much, Dr. Bernard. Now, I've heard of people with wounds that don't heal.
Exactly.
Swahili people call it dondandugu. So, but I've never really known that it could be a complication of diabetes.
Oh, yes.
All right. So now maybe before we go for a break, could you please share with us some signs and symptoms, the red flags that would tell someone that they are suffering or they could be suffering from diabetes mellitus?
Oh, yes. Now, as we said at the beginning, we say that diabetes, most of the time you will not have symptoms, okay? Initially, when your blood glucose is rising up, you're not going to have any symptoms, just going to be silent. Most of the time we just discover it in the hospital when you check your blood sugar. But now, when your blood glucose becomes so high, then some people start coming to saying that they are having what? They are having too much thirst. Every time they feel like drinking water, the throat keeps getting dry. They keep drinking water. I'm not saying you have diabetes because you're drinking water. Also, throat keeps getting dry. You keep drinking too much water. At the same time, you keep waking up in the night to go and urinate. Okay, you're urinating very frequently, more than usual. Okay, maybe you used to wake up once in the night to urinate, but now this time you're going like 3 times. Okay, then number 3, you also start having too much, feeling like eating every time. Okay,
insatiable appetite for food.
Exactly. Every time you want to eat, you keep getting hungry very frequently, unusually frequently. Okay, so they keep eating every time. You're having too much sugar in your body, but again at the same time your cells are not getting this sugar from your blood to feed it, so they keep complaining that you're hungry. So that's why you keep eating food every time. Okay, so these are some of the common symptoms people come with in the hospital. Okay, some people come with of course losing weight. If the sugar gets so high, then they start losing weight, but those are normally late. But the common things are normally getting thirsty frequently, eating frequently, urinating frequently. Okay, yes.
Thank you so much, Dr. Bernard. I'm told you're supposed to take a commercial break, but it's quite an interesting, informative talk on health right here with Dr. Bernard Lango. We'll be right back with more on this. Stay tuned.
Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theater nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com.
Welcome back, and thank you so much for keeping tabs with us here on Capuchin TV. Being a Friday, as usual, we bring you health talks and just make sure that we equip you with the information you need to live a healthy life. And today, as in our first session, as I mentioned, we are discussing more on diabetes mellitus, which is one of the chronic ailments which research has revealed that it's on rising, more prevalent due to the change in lifestyles and so on. So remember, this talk is brought to you by Capuchin TV in partnership with Mata Misericordia Hospital. And today, if you have just tuned in, I have an expert, Dr. Bernard Lango, and he is taking us through this informative session. Remember, welcome back to the second session, Doctor.
Thank you, Liz.
Now, you can be part of this conversation by commenting and sending your feedback on our social media handles and our contacts that are scrolling on your television. And before we wrap up the discussion, I'll sample some of your questions so that the doctor can respond to them accordingly. Now, we move on swiftly. And you can see it's a blue day. We both donning blue. It's a sign of royalty.
How did you know?
Is it a symbol of royalty?
It looks like a sign of fighting diabetes.
Absolutely, should be that. That one sounds right.
That's right.
Okay, now before we went for a break, you gave us some of the complications of diabetes mellitus.
Exactly.
Now, how do we manage these complications?
Oh yes, oh yes. Now, if you look, we're looking at these complications as a group, then also we look at it individually. Now, as a group, is that first of all, how do we prevent this? I mean, how do we prevent these complications from coming up?
Maybe
we can look at that shortly later.
Okay, maybe before we, sorry to cut you short. Maybe before we get to that, can we please understand if it's diabetes mellitus is curable?
Oh yes, diabetes mellitus generally is not curable. It's one of the chronic illnesses that it comes because of our lifestyle. So we don't really cure it, but we manage it, and we can manage it so effectively so long as both the patient and the doctor, they work very closely together, okay, and routine monitoring and making sure that we have very good control of the glucose levels. Okay, we can manage it very well.
All right. So now
the complications of diabetes, as we discussed, there are so many. Number one, when you look at it from up down, okay. Say I'm looking at the complication of because of diabetes, you have got a stroke. That's caused you to have a stroke. Then managing stroke is one of the difficult things in medicine, because having a stroke comes with so many complications. Okay, when you get a stroke, depending on how the extent of the stroke and which part of the brain has gotten a stroke, you may get paralyzed completely. Okay, you may not be able to feed yourself. You may not be able to talk. You may not be able to remember things. You may forget everything. Okay, things like that. So depending on which kind of the part of the brain has gotten the injury. So getting a stroke is one of the things that we need to prevent, okay, rather than managing when it has occurred. It is very difficult to deal with when it has occurred. But when it has occurred in the hospital, we manage the stroke patients to help them to try to recover the brain function as much as possible in a hospital setting, and after the hospital, also in a home setting or in a physiotherapy setting. Okay, all these group of people are helping managing somebody who has gotten a stroke. Okay. Then number two, if you have gotten blind because of diabetes, okay, we say it damages your retina, right? So if you're not able to see, sometimes in early stages the ophthalmologists, these people who operate complications in the eyes, they can always try to operate in the retina and try to help. But more importantly, as we said, we make sure that we control your blood glucose so that we don't continue damaging damaging the retina. So the stage you have got we start from there. We start from preventing further damage, and then we also try to do to correct the damage which has already occurred. Okay. So then number three, if somebody gets a heart attack because of diabetes, okay, you can get heart attack. Okay, what we call myocardial infarction. In the hospital setting, we have medications that we give. Initially, when the patient has just arrived, we try to give some medications to prevent further injury to the heart. Okay. However, sometimes when the patient comes late, because of this injury to the heart may fail to function well. That becomes now a bigger problem, because now that means that you start managing this chronic heart failure, which has come because you've gotten a heart attack. Okay, we also have to manage that. The medications we give, sometimes when you got a heart attack and you're rushed to the hospital very quickly, the doctors can do something to reverse the blood flow to the heart quickly, so that your heart may not fail to work in the near future. Okay. Then we have people who have gotten, as we said, diabetes causes people to get stomach disturbances, okay, gastritis, what we call gastritis. People who have diabetes tend to have chronic gastritis, okay. That is inflammation in the stomach, okay. It comes because of the diabetes itself. It also comes because of the medications of diabetes which we use. They also cause gastritis. Now, we manage those ones with medications, okay, medications in the hospital, We give you medication which suppresses the what? Acid production in your stomach, to try to make your stomach protected from further damage. Okay, we hope that the stomach can improve. Okay. We have people who have gotten diabetes because, I mean, we get wounds which don't heal, that you're asking earlier, because of diabetes. If you've gotten wounds which are not healing, the first thing when you take it to the hospital is that we check or make sure that we control your sugar very strictly. Okay, most of them we switch them to try to start injecting themselves with insulin, okay, to control the glucose very strictly, and then we clean these wounds. We dress these wounds frequently so that we make sure that these wounds can try to heal. This is very difficult for diabetic wounds to heal because of the glucose, which is always high, making sure that your wound is not healing easily. Okay. As we looked at diabetes, which is causing kidney injury, chronic kidney injury. Okay. When diabetes makes you to have chronic kidney injury, it's very important that, number one, we protect the kidney from further injury. That the stage which you have come to us, we protect the kidney from further injury, okay, by giving medications which are appropriate to protect the kidney. Number two, we also, if the kidney is too damaged to extent that it's not functioning well to sustain your body, then we take you to a process we call dialysis, okay. And if you look at the most dialysis units around town, including Mater Hospital, we have a big dialysis unit. Most of our patients, we are doing dialysis because they've gotten kidney damage from diabetes, and it's very sad because increasingly at young ages of 40 to 60 years, most of our people are going to dialysis, okay, because the diabetes has damaged the kidney. So you look at this. This is just some of the few I've mentioned, but we have so many complications diabetes presents. Okay.
But the idea is that you handle specific complications independently. Yeah,
there's a general way of handling. The general way is making sure that you control glucose very strictly if somebody has gotten complications from diabetes, but also you. As you control the glucose very strictly, then now you direct some medications according to what complication you are managing. Then other complications now involves those things of surgical procedures like the wounds, okay, things like dialysis as we're talking about for the eyes, surgeries in the eyes, things like that. So individual complications, we now direct treatment accordingly. Okay, these complications are very many.
And is there an age bracket which is prone to diabetes mellitus?
Oh yes. Now, studies have shown that currently there is increasing number of younger people who are getting diabetes. I remember those days when we were in school. We used to study diabetes as a disease of people who are 50 years and above, basically. But these days, that's not true, because diabetes is getting people who are in 20s. Can you imagine? This type 2 diabetes, which it used to come a bit later in life. But these days, because of our lifestyle, the kind of foods we are eating, the kind of sedentary lifestyle we are doing, we are getting younger and younger people who are in their 20s, 30s, and these days there's a big percentage of people who are in their 40s who have diabetes around Nairobi. You can see. So the age groups which are more prone to diabetes, basically somebody who is 20 years to 40 years, the chances are very high they're either getting into diabetes or they have diabetes, which is undiscovered yet.
Thank you, Dr. Bernard. Allow me to read one of some of the comments. Charles Omondi says, good one, Mater Hospital is the only health center to get the best quality medication. And we also have a question from Judy Erumbi, who is asking, what are the best dietary practices for patients with diabetes?
Oh yes. Now, diabetes, as we said, diabetes comes because of a combination of the nature of the food we are eating every day, which is accumulated over years, and two, also the exercise lifestyle that we are having, okay? And then three, some families which are more predisposed to getting diabetes. Now, what are some of the healthy foods that usually recommend in our hospitals and for people who already have diabetes, or people who have what we shall look at later, pre-diabetes. Now, when you have diabetes, we know your blood glucose is high, okay? So we want you to eat foods which don't make your blood glucose go very high. Now, these foods which don't make your blood glucose shoot so high are called low glycemic index foods. Now, when you look at low glycemic index foods, there are foods, things like vegetables, basically vegetables, okay. Fruits, most of the fruits, they have low glycemic index, okay. Though there are few fruits which also make your glucose go very high. We have whole grains, okay. We have nuts, okay. These are foods which have low glycemic index. So when you eat these foods, your blood glucose don't go very high. In our local settings, if I'm discussing with a patient in a hospital setting, I first look at what are the foods do they eat, do they have access to every day. They will tell me, of course, I have access to ugali, I buy rice, I buy spaghetti, I have access to meat, beans, this. So when the patient has mentioned the things they usually are able to buy to eat every day, then we look at them individually. Okay, then I discuss with them. Now, in this group of things you have listed to me that you are able to buy, ugali, when you're buying ugali, buy the one which is brown, okay? And you take as little as possible of this ugali because it makes your glucose go high. Rice, you buy brown rice, okay? Because it doesn't make your glucose to shoot so high because it takes long for your intestine to digest it, to break down to glucose form. Okay, if you have access to access to bread, I advise you to buy brown bread, okay, instead of white bread, because white bread makes your glucose go very high. If you have now that you have access to those vegetables, okay, all the vegetables are good. They can always use all the vegetables. So each time I'm discussing with the patient, you need to put in the context of what they are able to afford, so that you split between the food which are making the glucose go high and the glucose, foods which are making the glucose get a better control. Okay, but in general, those things of white rice, white bread, they make your glucose go very high. Okay.
All right.
Vegetables generally are good for these diabetic patients.
Thank you so much for that insight. Now, apart from the best dietary practices, what other preventive measures can we embrace to stay safe from diabetes mellitus? Oh yes. Now, as we said, diet important. The next important thing is exercise. Exercise is very important. Exercise, almost all of us can do exercise, except people who we have very few categories. People who it's very difficult for them to exercise, especially people who don't have their legs or are unable to walk. Okay, but still some of them are able to swim. So exercise in forms of cuts from running, jogging, walking, fast walking, which make you to sweat, okay, going to swim, riding bicycles, okay, any exercise you are able to do which makes you to sweat a lot every day, okay, you are able to, we need to embrace exercise as our daily routine. In developed worlds, people have decided to change the kind of transport systems in their cities by banning away private vehicles from the cities. So you are able to use the train service, drop somewhere at the train station, then you walk up to where your office is. So almost everyone walks. So we should embrace walking. Much as you don't get time to exercise, going to the gym later, you have to what? You have to walk as much as possible if you are able to do that. If you're not able to walk, if you're able to swim, you swim. Okay, if you're not able to swim, do this mugging people do. If you don't have your legs, you're not able to swim, you can do the mugging. Okay, they still exercise those bunch of muscles. Okay,
which are able to help you to what? To break down your glucose, blood glucose. So exercise is paramount if you're talking about controlling diabetes, a healthy lifestyle, besides the diet.
Thank you so much, Dr. Lango. Now, as we wrap up, because our time is up, please share with us. You mentioned pre-diabetes, and there are some types. When you go for diagnosis, you might be told you have type 1, type 2.
Exactly.
And then could you please share with us what these are, what they mean medically, and what are the chances, or how easy is it to manage each one of these?
Oh yes. Now starting from let's start from pre-diabetes. What we call diabetes is when we test your blood glucose and you've been starving overnight. You go in the morning, early in the morning in the hospital. We call it fasting glucose. And your glucose is 7 and above. We call that diabetes. Okay, if you've been fasting overnight, I mean you've last ate supper the whole night, you have not eaten in the night, then you come in the morning, then you check your sugar and it's still 7 and above. We call that diabetes. If you check that sugar when you're fasting and your sugar is between 6.1 to 6.9, we call that pre-diabetes. Okay. Then when we check your sugar and is less than 6.1, we say you are healthy. Then if you have eaten, you have not been fasting, you have eaten, you've taken breakfast already, or you have taken lunch, and you come to the hospital. Okay. After 2 hours of eating, we expect your glucose to be less than what? To be less than 11.1. Okay. So somebody whose glucose reaches 11.1 and above, okay, it's called diabetes. That is for people who have not been fasting, right? In the last 2 hours, you've eaten something, okay? We call that diabetes. However, if you check that sugar when you have not been fasting and is between 7.8 up to 11, we call that pre-diabetes. You see that? So the interpretation varies with whether you have eaten or you have been starving.
Okay.
So that one we call it pre-diabetes. Then people who have eaten something, then after 2 hours, their glucose is supposed to be less than 7.8. That is if you are healthy.
Okay. Now please tell us, because time is up. How easy is it to manage pre-diabetes or type 1 and type 2? Oh
yes. So now when you're now having pre-diabetes, that is a stage that we need to have good control of your glucose so that you don't get into real diabetes. Okay. All right. Because diabetes, it comes with a lot of complications. Okay. So what we do, we normally start you on some minimum medication. Then we strongly discuss lifestyle changes if you are pre-diabetic. Okay. We tell you we discuss with you details of exercise, the details of the food you're going to eat every day. Okay. And sometimes we start you on some minimum medication to manage you from getting into diabetes, to prevent you. Then that one is very easy to deal with. When you get diabetes, it's more difficult. Then the other thing you asked was after when you've dealt with the pre-diabetes, okay, and you prevent somebody from progressing to diabetes, you're likely going to prevent a lot of complications which will come along. Okay. What the other question was?
No, maybe you give us your final remarks. We close.
Oh yes.
Okay.
So So today what we want to emphasize on is that number one, diabetes has a lot of complications which comes along, and it lowers our lifespan. Okay. If we manage it before we get to diabetes, it is going to be much easier for us, because it's very expensive when you have diabetes to take medication, to buy medications every day, and then to treat the complication which will come along. Okay. Okay. Healthy lifestyle involves healthy eating, having vegetables, fruits every day in your diets. Okay. Much as you are enjoying those ugali, prevent yourself from craving for those fast foods. Okay. Try to exercise every day, the kind of exercise which you are able to afford. Okay. Depending on whether you have access to the gym, you don't have access to the gym, you have your legs, don't have your legs, we are all able to do some sort of exercise which will able to make us have prevent ourselves from getting diabetes.
Thank you so much, Dr. Bernard Lango. I wish we had more time to get to know more about that, but I believe we'll create more time for that in future. So thank you so much for that informative session. And thank you, dear viewer, for taking time to be with us live on Capuchin TV this Friday morning as we demystify diabetes mellitus. Remember, this is brought to you by Capuchin TV in conjunction with Mater Misericordia Hospital. Now we bring you such talks every Friday, and I would like to extend my gratitude to the entire team behind the scenes, starting with the gentleman right next to me. No, before me, this is Felix Juma, camera operator, our visual mixer Cherubor Samuel, our sound engineer Frederick Ochieng, aka DJ Fredox, and our transmission desk manner, that is Peter Mwangi. Thank you so much, guys, because this wouldn't have been successful without your efforts. And I would like also to remind you to keep your questions coming, and we will make sure that you get the right responses from medics and experts in that field. Thank you so much for being with us. And as we wrap up, just to give you one quote on health, life, and balance. To ensure good health, just eat lightly, breathe deeply, live moderately, cultivate cheerfulness, and maintain an interest in life. My name is Sasha Elizabeth. See you next time. Goodbye.
Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research, and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theater nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com.
You are watching Capuchin TV. For any complaints, comments, or compliments on our programming, You can either write to us on info@capuchintv.co.ke or you can call us directly on 0717 424 866. Your complaint shall be addressed within 7 days. Remember to keep a copy of your communication with us. Keep watching Capuchin TV, your Catholic identity.